Good morning from the Oklahoma Insurance Department. My name is Rachel Fan, and I work in the Communications Division here at OID. Thank you for joining our Senior Fraud webinar series. For your awareness, I do want to mention that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also help deal with your insurance company if you can't reach an agreement regarding a claim. If you would like to reach out to us for help, or if you have any questions, you can call us toll-free at 1-800-522-0071. And you can also visit our website at oid.ok.gov. For today's webinar, you will be able to see and hear us. However, we cannot see or hear you. If you have a question, please feel free to post that in the chat. Down at the bottom of your screen, you will see several options, one of those being chat. And if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now I'd like to introduce today's speaker, Ray Walker. Ray is the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has over 20 years of experience working in and around the healthcare industry, primarily in insurance, and has had the privilege of speaking to groups across the state and around the country. Ray, thank you so much for joining us today. We're excited to hear what you have to say.
Thanks again, Rachel. I appreciate all your help with all of these webinars. This has been very interesting. As all of you know, with the onset of the pandemic, it forced us to start utilizing technology a lot more. And for any of you who know me very well, you know that technology is not my friend. So I could not have done any of this without the help of Rachel and Brittany and the people over in communications. They have been awesome to help us continue to get this message about fraud out to everybody. So I'm going to get started on my presentation, and today's topic is Medicare fraud. Very quickly, I just want to ask a quick question. Rachel, are you seeing everything the way we want to see it? Everything looks right?
Yep, Ray, everything looks great. Thank you.
Excellent. Great. Well, we're going to move forward. So let's get started on talking about Medicare fraud. You know, this year, 2022, everybody who was born in 1957, guess what? They are turning 65 this year.
Hey, Ray.
Yeah?
Now your presentation's in the wrong mode.
It has?
Yes.
Well, then let's see. What do we need to do?
Looks like we're working on that.
Get this switched over. I am going to switch this around. There we go. Now tell me what you're seeing now.
So Ray, it looks like we're still in that.
How about now?
Still the wrong one. So why don't we just click on those three dots at the bottom of the screen?
Sorry, folks.
And then just hit hide presenter view.
There it is.
Awesome. Thanks, Ray. Everything looks great now.
Awesome. Great. Thanks for your help, everybody. See what I said about technology? I was serious. So now let's get looking at this. In 1957, Bobby Fischer became a chess champion at the age of 13. Some people say it was 14, but he was the U.S. Chess champion at the age of 13. And I think it was 14 years after that he became the world chess champion. Two movies came out this year. One of them was 12 Angry Men, which was arguably one of the best films that was ever made. It was unique in that the jurors that were these 12 angry men, they were all identified by number. They didn't have a character's name. And it was considered by many to be the second best court-related movie that was ever made. And of course, most of you probably already know that the one that was number one was To Kill a Mockingbird with Gregory Peck. It was nominated for a lot of Academy Awards, but you know what? It was beat out by another movie, The Bridge on the River Kwai. that had a whole slew of famous people in it and won like 7 Academy Awards. Leave It to Beaver came out. A lot of us remember coming home from school every day and watching this show. I can still remember the people, Barbara Billingsley, Hugh Beaumont, Tony Dow, and Jerry Mathers as the Beaver. I heard that so many times, it's one of those things that I will probably remember forever. The other thing I remember about it is they use terminology like gosh darn and creep and stuff. And I remember the parents in this show getting so upset that their children were using this kind of language. Totally different today, isn't it? The book, The Cat in the Hat, that everybody has heard of, that was the year that that book was published. It was actually created initially as sort of an alternative to a primer for students to learn how to read. And the gentleman that wrote it, Dr. Seuss, that was his pen name. He went on to write a number of other books and sold over 600 million copies around the world. So, and then also, last but not least, the Whammo Frisbee came out. It actually came out probably about 2 years earlier under the inventor that I don't remember the gentleman's name, but it was called the Pluto Platter. But he sold that to Whammo, who then remarketed it as the Frisbee. In the same year, Whammo came out with another of their best-selling products that was marketed as an exercise device. I'm sure you've probably already figured out that was the hula hoop. So in 1957, the world was a completely different place. For one thing, the average cost of a new home, $12,000. Average annual wages was about $5,000. Another thing, a can of Coke cost you 5 cents. Interesting, a can of Coke continued to cost 5 cents till about the 1970s. The average cost of a new car was about $2,757. Now that's the average cost. If you wanted to go high dollar for a Cadillac, you were going to have to shell out more like $7,000. Gasoline cost about 24 cents a gallon. If you wanted a pot roast for dinner, you were going to pay about 69 cents a pound for that meat. The other thing, Medicare would not be available for another 8 years. Medicare didn't come out until 1965. So at that point in time, seniors who needed assistance, there was no Medicare to pay for that. You know, it's very interesting when you think about it. The medical care, if you received a service in 1957 that would have cost you $20, that same service in today's dollars would have cost you over $500. The inflation rate has been significant. The Medicare average inflation rate has been over 5%. When you compare that to the overall inflation rate of 3.61%, you can see how medical costs are surpassing that inflation rate at a much higher rate. So it's even more important that we are vigilant about monitoring how those dollars are being used. Another significant factor about 1957, that was the year that had the highest number of births recorded. There were 4.3 million babies born in that year. Over the course of the years, the baby boomer years, as we refer to them, which is basically 1946 to 1964, there were 76 million babies that were born. So over the next several decades, we're going to see 10,000 baby boomers turning 65 every single day. That's significant. By the year 2050, they're going to represent 20% of the total population. The youngest baby boomers are going to turn 65 in the year 2029. What makes that even more significant is that the oldest baby boomers will be in their early 80s at that point, which is really not considered that old in today's terminology. People are living much longer than they used to. So there's a very high probability that we're going to have the youngest and the oldest baby boomers all on Medicare at the same time. It is critical that we do everything we can to protect that Medicare trust fund. So that's one of the reasons why this program was created. One of the grants that funds the Medicare Assistance Program at the Oklahoma Insurance Department is the Senior Medicare Patrol Grant. It gives us money to go out and educate people on how they can protect themselves from becoming a victim of fraud, waste, and abuse in the Medicare system. It was a program that started back in 1997, started out with some demonstration programs just to see, kick the tires, see how it worked. Today, it's in every state, it's in every territory, and so far to date, the program has saved over 138, almost $139 million. This is a huge problem. When we think in terms of Medicare fraud, the tendency of most consumers is to immediately say, this is a problem for the elderly. Well, guess what? If you're a taxpayer in the United States of America, it's your problem too. Billions of taxpayer dollars are lost every year to these improper payments. Not everything is fraud. A lot of the money that's lost is improper payments. It's a mistake, a bookkeeping error that somebody made. Or maybe somebody accidentally pushed a button twice. A lot of the money that's lost is just human error, but it's lost nonetheless. It's money that shouldn't have been paid. So it's in everybody's best interest that we're doing everything we can to make sure that the money that is spent is being spent appropriately, on appropriate care, at the right cost. If we don't do that, the results are going to impact all of us. It's going to result in higher premiums. It's going to result in a decrease in the quality of care that people are receiving. It's going to mean that there's less money in that Medicare trust fund to pay for needed services later on. We all hear the news reports about the trust fund is going to run out of money. It's estimated by XYZ years. So we want to make sure that we're doing everything humanly possible to try to extend that Medicare trust fund. In some testimony before a government regulatory committee, the Government Accounting Office estimated that over $1 billion had been recovered and returned to the Medicare Trust Fund as a result of recoveries and fines and forfeitures. That's great news. Unfortunately, in that same year, they also estimated that over $50 billion was lost due to improper payments. And you'll notice that in a lot of the information that we share, you'll see that word estimate. Why are we using that term? That's because there's a lot of stuff out there that we don't know about. If people don't report suspected fraud, if they're not being diligent about monitoring their Medicare summary notices and their explanation of benefits and other documents, a lot of times this fraud goes unreported. So we don't know about it. So we have to say that it's an estimate. The sad news is it could actually be significantly more than that. Now, there are also individual consequences for not reporting potential fraud. If a person's Medicare number is stolen, it can be utilized to file false claims with Medicare. So as a result of that, Medicare pays these claims and the money is gone. The other consequence is your number can actually be sold. And that's something that we see quite a bit. The individual who may actually be acquiring Medicare numbers, they may take action on their own as far as filing false claims and things like that. But a lot of times they have kind of a side business, you might call it, where they're actually selling that information on the dark web to make extra money. And then whoever is purchasing that can then utilize that to further, promulgate claims that they send into Medicare and stuff. It also creates errors in your medical record. Let's say that a bad guy gets a hold of your Medicare number and they file a claim with Medicare that would imply that you have a certain health condition. Maybe whatever the claim is, it implies that you have diabetes or cancer or something like that. Now that information is contained in your electronic medical record and it can impact future care that you receive. The other thing that it can cause is it might impact your ability to get needed services. Let's say that there's a claim that was filed, a false claim that was filed with Medicare that implies that someone provided you with a wheelchair and Medicare paid that claim. Medicare is only going to pay for a wheelchair. Let's say that somebody who legitimately needs a wheelchair, Medicare will pay for a wheelchair every 5 years. If it's within that 5-year period and you really need a wheelchair now, but according to Medicare records, you already got one, they're not going to pay for another one. So it can cause a lot of downstream issues with a person's individual care if their Medicare number is compromised. The last bullet point here is the energy and the time and the trouble that it causes to the individual to clean up those records. There was a story about a person who was not on Medicare yet. This was just an average person under age 65. She had insurance. She had left her purse in her car and went in to pay for gasoline at a convenience store. When she came out, her purse was gone. She reported it, did everything she thought she was supposed to do, kept an eye on her financial records. She didn't see any fraudulent claims that came up. She thought she was good. A few months later, she had a visit from law enforcement, and they were telling her that she was in trouble because it appeared that there were several prescriptions for pain meds that had been filled using her insurance. And she found out that one of the cards that had been taken was her insurance card, and that whoever this person was that had taken this was going around and visiting multiple medical clinics and they were getting pain meds. And had been identified as her, and they were basically claiming that she was getting all of these opioids fraudulently. And she was able to convince them, though, that it was not her. However, as a result of this issue, her insurance number and these false claims were in the hands of a variety of providers in multiple states, and it took her a very long time to get all of those cleaned up and to get her credit report cleaned up. So it's very important that you're being vigilant about monitoring any of those documents that identify any claims that have been submitted to Medicare or to other insurance on your behalf. Now, one of the things that they've done that has really, really helped with the Medicare fraud issue is they changed the Medicare cards and they changed the Medicare numbers. The Medicare card used to use your Social Security number as the main identifier, and that's challenging because your Social Security number, as you know, is tied to so many different accounts, your mortgage, your bank account, everything. So removing that from your Medicare card has been a very big help in trying to prevent some of this fraud. The new numbers are what's called a non-intelligent unique identifier. It's a random combination of letters and numbers that is still 11 digits long, but it isn't tied to any account. It's not tied to your bank account or anything like that. So that's really nice. It's not something that a person could steal and then connect to any of those other things like your credit card or anything like that. The number itself has certain things about it that are going to be consistent. For one thing, the positions 2, 5, 8, and 9 are always going to be an alphabet letter. And there are certain numbers that aren't going to be used that look too much like letters. For instance, like 5. They don't use the letter S because it looks too much like a 5. Now, some things to keep in mind, some points about this that you want to be aware of. If a person were to lose their Medicare card, you can actually print out a new one. In the past, you could not do that. Now you can go to Medicare.gov. Now, this is assuming that you, as a Medicare beneficiary, has created your Medicare.gov account. This is something that started a couple of years ago, where people who are on Medicare can go to the Medicare.gov website, and you sign up for an account. You get a username and a password, and this gives you the ability to see your Medicare account. You can see claims that have been submitted on your behalf. You can see preventive services that you may be eligible for. You'll be able to see what prescription drugs have been submitted for payment so that you can kind of keep track of your current prescriptions. It's a lot of benefits. But it also gives you the ability to print out a new Medicare card if you need to. Now, something else that people do still need to do, Social Security still plays a key role in the Medicare system. Social Security, you may recall, is the agency that actually handles the enrollment process for the Medicare system. So it's very important that people remember, if they were to move, that you report that change of address to the Social Security Administration. That has created some issues for some of our beneficiaries who are still calling us and saying, hey, I never got my Medicare number. and I'm still using my old card. Well, the fact of the matter is, those old cards, the old Medicare numbers, they've been turned off. The system won't work with those anymore. So people have to have the new Medicare numbers. So if someone hasn't gotten one, or you're helping a loved one, maybe you're a caregiver, and you notice that that Social Security number is still on there, you need to be reaching out to Social Security and find out what's going on. It could be that an address change wasn't reported to them, or maybe it was thrown away thinking it was junk mail. So you need to get that straightened out. Last thing on here, if a person, let's say that you've reviewed your Medicare summary notice and you do identify a charge on there for a provider you didn't see, or you see a charge on there for services you were not provided, that could be potential fraud. You do have the ability with these new numbers. Medicare can actually issue you a whole new number. Think about if you were to lose your debit card. And you know how you can go to the bank and they can issue you a new card with a new number? The same is true with the new Medicare numbers. So this is really a great improvement in the Medicare system, in that once a card has been used to commit fraud, they can actually change that number and stop the hemorrhaging. Now, that doesn't mean that with these new Medicare numbers, everything is fraud proof. They can still use the new Medicare numbers to file false claims. So it's still very, very important that individuals are taking the time to review their Medicare summary notice and their explanation of benefits and those other documents to identify if they see any claims that don't look right to them, and then reporting those to the proper authorities. The other thing to keep in mind is anytime something like this happens where there's an improvement, we'll call it, to the system, the fraudsters are right on the heels trying to think of how can they capitalize on that new situation. How can they turn that into profit for them? Let's say, for example, somebody shows up at someone's door saying, yes, I'm with Medicare, I'm with the Centers for Medicare and Medicaid Services, and unfortunately we've identified that there's been a challenge. There was a mix-up. Somehow your Medicare number has been used to file multiple claims totaling thousands and thousands of dollars with CMS. And they're showing up on your record. And this is going to be challenging. We're really sorry. You're probably going to get some bills from some of these providers saying that you owe 20% and they're going to be demanding payment. We're just really, really sorry. We want to try to help you get this worked out. So we need to cross-reference your correct Medicare number with the number that these should have been billed under. If you could give us your Social Security number so we can pull that up, that would be great. What they're trying to do is to scare you into thinking, oh my gosh, I'm going to be responsible for all of these co-payments and co-insurance, or I'm going to have to spend all of my time getting this straightened out. I better let this person help me. Don't do it. Medicare isn't going to call you. Medicare isn't going to, that will not happen. So don't fall for something like that. If someone tries to convince you to do that, the best step for you to take is to discontinue that conversation, slam the door in their face, whatever, and you can call 1-800-MEDICARE. The thing to keep in mind is while the new Medicare numbers can be changed, your Social Security number cannot. And if it ever gets in the hands of the bad guys, it can create all sorts of problems for you. So never, ever, ever, ever give out your Social Security number to anyone unless you know for certain that that individual needs it. So please keep that in mind. You know, it would be so great if the bad guys looked like the bad guys, or if when they called, they said, hi, I'm Sam the Scammer, and I'm going to, wreak havoc on your life. Ready? But that's not the way that it works. Most of the time when you're getting approached by someone who's wanting to commit these crimes, they look very normal. They look really nice. They're very friendly. They're very approachable. That, or they come across as being very authoritarian, like they're law enforcement and you better do what they're saying and stuff. They spend a lot of time perfecting what they're trying to do to get at your personally identifiable information. And so it's very important that people understand not to fall for these scams. For one thing, as I said a moment ago, Medicare and Social Security are not going to call you on the phone. They're also not going to show up at your door. They're going to correspond with you through the mail. Now, I will tell you, there is a survey that CMS does of beneficiaries, It's through NORC, N-O-R-C. So you might get a call from NORC, and I wish I could tell you it's an acronym that has to do with opinions, and it's through the University of Chicago, but actually their name is now NORC. They don't even use the acronym anymore. So you might get a call from them. If you do, and they identify themselves as NORC doing a survey for CMS, they will never ask you for your Medicare number. They won't ask for your date of birth. They won't ask for your social security number or anything else of that nature. So don't give it out. Anytime anyone calls asking for you that information over the phone, don't give it to them. They have no reason to get that information. Also beware of callers that are claiming to be from law enforcement agencies that need that kind of information. That's typically not the way they're going to interact with you. Now, if you have made an outbound call, if you're trying to report something to a law enforcement agency and you've received that contact information from another source, that's a different matter altogether. But if someone is reaching out to you, don't give out that personally identifiable information unless you know 100% that's who you're talking to. The same thing is true for a healthcare provider. There was a story about an individual who had put on Facebook about an upcoming procedure in the hospital. I don't remember if they were going to be inpatient or outpatient, but they basically had put on Facebook a prayer request, wanting someone to, wanting their friends to be aware that this was going on. And they had said that they were going to go to XYZ facility for surgery next week, yada, yada. A bad guy happened to see this on the internet. They called the individual saying, "Hi, I'm from the local hospital and we're getting ready for your surgery next week and we wanted to do some pre-admission paperwork. Are you ready? If you'll get your Medicare card, we'll go ahead and get you registered." And so this person, thinking they were talking to the facility where they were going to receive services, proceeded to give all of this information over the telephone. So be very, very cautious about who you're talking to on the phone and who you provide this information to. If you think that it might be legitimate, if you think there is the possibility that there might be that pre-enrollment or something like that, don't hesitate to say, "Look, I'm a little bit concerned. I don't know you and I don't know for a fact who you are. I'm going to hang up and I'm going to look up the phone number for the hospital admission office and I'm going to call it back." If they're legitimate, they'll understand and they'll let you do that. If they're not legitimate, they're probably not going to be very happy about it. But it's a good safety thing to do. Another thing to be aware of, if somebody calls you and, unfortunately today, they can spoof their phone numbers to look like anybody. Spoofing is a technology that they can use with a computer where when the call comes in on your iPhone or whatever you're using, the caller ID is going to say whatever they want it to say. It can say the area code for the Washington, D.C. area. It can say it's the local hospital, any number of things. But if you answer the phone and you understand, you realize that it's probably somebody that's fraudulent or they're trying to sell you something or they're telling you your warranty wore out on your car, whatever, the fraudulent thing or the prudent thing to do is hang up the phone. Just disconnect the call. What you don't want to do is if somebody calls you and says something, don't just say yes. Say, "Can I help you?" All right. There have been some reports of the possibility of these people being able to take that recording of you saying the word yes and using it for other purposes. So it's just more prudent on your part to just say, "Can I help you?" Because it means something completely different than just yes. The other thing to be aware of using the telephone, there are sound effects that are available through the computer that they can make the background noise sound like they're in the hospital or that they're at a police station or something like that. So don't assume that what you're hearing that's going on around them is legitimate. All right? If you don't know who they are, just hang up the phone. So very quickly, let's talk about some of the cases that we're seeing right now so you can kind of get an idea of what's actually being prosecuted. Here's a story of a doctor in New Jersey. She was a rheumatologist and she got in trouble because she was billing Medicare for certain infusion medications. Now, infusion medications, for anyone who doesn't know, this is medication that you receive while you're actually in the clinic, in the doctor's office, something like that. Sometimes they can be cancer-related medications, sometimes rheumatology. There are other diagnoses that use infusion therapy. And the way it works, drugs that are used for infusion therapy are actually paid by Medicare Part B as opposed to Part D of Medicare. And between the years of 2010 and 2019, this doctor billed Medicare for millions of dollars of these infusion drugs. But what was interesting is upon further investigation, they discovered her clinic never bought these drugs. And so there was no record that said, well, you billed Medicare for providing these medications to clients, but how did you do that if you never bought any of them? So she got in big trouble. She wound up going well, I don't know. At the time, she's been convicted, but she hasn't been sentenced. She is facing up to 10 years in prison for each count on those crimes. The next one is very interesting because it deals with the pandemic that we're still dealing with, hopefully, is the tail end of the pandemic. This is a gentleman by the name of Billy Joe Taylor from Arkansas. He owned and managed multiple clinics, and he is charged with healthcare fraud. They charged over $100 million in false claims to Medicare for urine analysis, for COVID tests, for a variety of things that were allegedly performed, but that were actually never performed. Also that were not ordered by providers. The tests themselves were not actually even done in a lot of cases. So here's a picture of the gentleman. From the records, they found out that he used the proceeds from all of this to purchase real estate, jewelry, guitars, which I thought was interesting, automobiles. The picture that you see here, that is a very expensive automobile. That is a Rolls-Royce Wraith. Never heard of it before. But I will tell you this, that car sells for about $340,000, more than my house. And that was the car that he bought. So anyway, he was charged with 16 counts of healthcare fraud. And anyway, he's in a lot of trouble and will probably not be seen for some time to come. Now, those were two examples of where the fraud was an individual person that was brought to trial for those things. A lot of the cases that we see, though, actually involve multiple defendants, and in fact can involve multiple states. They are scams that involve a network of providers and a network of clinics and things like that. And a lot of these are cases that are investigated over years. The law enforcement entities become aware of what's going on and they monitor the situation, and they will keep track of it for a long time as they are trying to, they want to get enough evidence. They want to make sure that they've got a solid case before they actually drop the hammer on these guys. So here's an example. There were 16 defendants, including 12 physicians, who were sentenced to prison for distributing 6.6 million opioid pills and falsely submitting 250 million in claims. Now here's the story. This is a really sick situation. This was in the Michigan and Ohio area. There were clinics in both areas. These providers would require for any of the patients, these were pain management clinics, patients would come and they were there to receive pain management treatment. Now, unfortunately, a lot of these clinics were identified pill mills. That's sort of a slang term that means these are known facilities where people with drug addiction problems and drug dealers would go to try and obtain large quantities of opioids. And unfortunately, the providers there were known for providing them. But in these situations, they were requiring the people that were coming to these clinics to submit to very painful back injections, spine injections. The medication that was being used is a very expensive medication that was being injected. And so in exchange for getting all of these opioids, they were also making people get these back injections. Again, it was multiple clinics across both states. The physicians that were involved in this, to kind of stay under the radar, they worked shorter hours. They might only work like 4 hours or something like that. But what was interesting was they were still among the highest prescribers of opioids in the Michigan area. So like I said, the patients were required to submit to these very expensive injections. They were called facet joint injections. And the reason why they were getting these is because they were one of the highest reimbursing procedures that they could receive. It had nothing to do with medical necessity. And so consequently, not only did these patients have to get these injections, which sometimes were more painful than whatever it was they were coming to the pain clinic for in the first place, but a lot of times these people had subsequent health issues. There were even reports of like gaping wounds that these people developed from having to receive these multiple back injections. So it was a really, really sad situation. As a result of this, it showed that the physicians, they got, they were buying gold bars, they were buying indoor basketball courts, they were getting courtside tickets to NBA games, multiple ways that they were spending this money. So again, a lot of times these investigations may not happen very quickly. It may happen over multiple years, but hopefully in the long run they can capture this. Unfortunately, frequently it's very difficult for them to recoup anywhere near the amount of money that has been lost. So let's talk about a few places where you need to be vigilant, where you need to be watching and paying attention. It's not always going to be at a doctor's office or something like that. There are other places where fraud and abuse and just errors can take place. What you're going to see as we go through some of these is there's a lot of commonality in terms of the ways that you as an individual need to take action. What are the steps that you need to do to protect yourself as well as helping protect the Medicare Trust Fund? For instance, let's talk about home health agencies. What are you looking for? Be aware, look for charges for services that you didn't receive or charges for something that are different than what you received. One of the things that sometimes people will say is this incredibly nice person came to their house and visited with them. Yeah, they talked about medical stuff and, were so nice and they really appreciated them and stuff. But what actually happened is there were some charges that were on the Medicare summary notice that indicated that this home health worker had done quite a bit of stuff in terms of medical services while they were at that visit, which didn't really occur. But because they were so nice, the person just assumed everything was correct. Charges for more services than what they received. In other words, if you see like it looks like you're being duplicately charged for something. Another big issue with home health agencies, one of the requirements is that the person be considered homebound. One of the reasons why they're receiving home health is because it's difficult or challenging for them to get out to go get those medical services elsewhere. So it is important that people that are receiving home health services do meet that criteria to be considered homebound. Unfortunately, there have been some home health agencies in some areas that have worked with prescribers that have said, yes, this person meets the criteria for homebound services. Here's an example. There was a senior living facility, kind of an apartment complex, where people were going door to door and they were saying they were there to do a blood pressure check. And they were in scrubs, they had a stethoscope, they looked very clinical. And they told one person, well, your doctor sent me to do this blood pressure check. And, they probably did check the person's blood pressure. Told another one that, well, we're just trying to keep you out of the nursing home. And so once again, they checked the person's blood pressure, but they did this at each one of these apartments where they were doing this. They always got the person's Medicare number, and they would turn around then and bill Medicare for the services. Skilled nursing facility services, pretty much the same thing. You're going to look for services that you didn't receive or that are different than what you received. Or maybe for unnecessary services, something that maybe you weren't actually admitted for there. Or possibly billed for more advanced services than what you received. For example, maybe you got a simple x-ray of like a shoulder or something like that, but what was actually showing up on your bill was an MRI or a CAT scan or something like that. One example of fraud that we heard about. Now, this wasn't in Oklahoma. In fact, the previous one wasn't in Oklahoma either. But there was a facility that basically had bingo one night for the people that were in this skilled nursing facility, which was a lot of fun. But what was interesting is they turned around and they billed Medicare for group mental health therapy. And I think bingo's fun, but I don't know that I would qualify it as mental health therapy. DME, again, the same thing as far as looking for equipment that you never received or that's different than what you received, but there's a couple of here that are also new that you need to be aware of, such as we do see from time to time or hear from time to time about where there'll be a booth or something like that that offers free equipment uh, to individuals who are on Medicare. And what they'll say is, you come to this booth for this free equipment, and they say, okay, well, we need your Medicare card because you got to prove that you're on Medicare. We can't just be giving these out to everybody. And so they'll get your Medicare number and they'll write it down, and they turn around and bill Medicare for that item or possibly even more items. Another way that fraud is sometimes committed related to durable medical equipment is in delaying picking up durable medical equipment that was rented or leased for short-term treatment, such as there sometimes are people who leave the hospital and they go home, but maybe they need a hospital bed for a short period of time. And so consequently, Medicare does cover hospital beds in some of those situations. Then when the person doesn't need that hospital bed anymore, and you call the durable medical equipment company to come pick it up, they kind of drag their feet on coming out to get it because as long as that piece of equipment is in your house, they can keep billing Medicare for it. So consequently, it can sometimes be a week, 2 weeks, a month before that piece of equipment gets picked up. That's a problem. So you need to be aware of that. Here's one example of DME fraud that actually did occur. A DME person came into a senior center and he was offering everyone at the center a free scooter. Now we're talking about those hover around kind of things, not the big fancy stuff, and in exchange for their Medicare number. And so as a result of that, the company then turned around and billed Medicare for the much more expensive high dollar electronic wheelchairs. So what was provided to the people at the facility was the scooter. What Medicare was billed for was these big electronic wheelchairs. Subsequently, what happened, one of the individuals at this nursing home that fell, or not nursing home, senior center that fell victim to this scam had a stroke and subsequently needed one of these very specialized wheelchairs for mobility purposes. But unfortunately, according to the Medicare records, they had already been provided with one of these wheelchairs, and it created problems for them in terms of getting the equipment that they needed to be able to continue functioning. Another example, a DME supplier set up a table in the lobby at a senior center and saying free shoes to Medicare beneficiaries. And so once again, the senior, they approached the table. They were basically given a pair of shoes that were bought at the, kind of a local store like Dollar General, Walmart, or something like that in exchange for their Medicare number. And then the person turned around and then billed Medicare for these custom orthotic type diabetic shoes. This is a double problem. One, these custom orthotic diabetic shoes are much more expensive. And two, now it looks like those people have diabetes. Some rules to be aware of related to DME. One, this is one of the areas where people get a lot of unsolicited telemarketing. We used to hear, I've been doing this for many years now, but there was a scam that was going on where literally the telemarketer was calling saying, hi, do you hurt? Well, as we get older, pretty much all of us hurt somewhere. And so consequently, there was a lot of people that were getting sold wrist braces, elbow braces, all sorts of stuff that they really didn't need. And what they were thinking they were receiving was a much more high dollar piece of equipment than what was actually being provided. What showed up in the mail was typically one of those neoprene kind of braces that you as an individual could purchase off the shelf in Walmart or Walgreens or someplace like that. So it's important that you understand DME providers are not supposed to be contacting you unless you've given them permission to do so, unless you've contacted them first. So if someone calls you, just cold calls you and asks you a question like that, you just need to hang up the phone. Unless you've asked them to call you, or unless you've got a previous relationship with that provider, they're not supposed to be contacting you at all. And that same rule applies to emails, in-person contact, internet advertising, etc. So let's talk very quickly about some of the do's and don'ts, kind of the overall, what are the things you should be doing as a Medicare beneficiary or as a caregiver to protect your Medicare information. One, You want to treat that Medicare card just like it's a credit card, because in the hands of some people, that's exactly what it is. We want you to watch out for identity theft. Be sure that you're monitoring not just your Medicare summary notice and your explanation of benefits for your drug plan and stuff for anything that you didn't purchase. Watch your credit card statements as well. Anything that might indicate that somebody is using your information for purchases they shouldn't be. Be aware that Medicare does not call you or visit you to sell you anything. If somebody shows up claiming they're from Medicare, but then they try to sell you an insurance product, they are not who they claim to be. Don't fall for it. Don't give your Medicare number, except it to your doctor or some other medical provider. In fact, they suggest that you don't even carry your Medicare card with you unless you know you're going to need it. If there's a true emergency, if you're in a car wreck or something like that, they're going to treat you first and then worry about identification later. But be aware of that. Now, they're not as worried about you carrying your card now that they've changed the Medicare numbers, but it's still something to consider as to whether you really do need to carry that with you at all times. Second step, we want you to help us detect Medicare fraud. The best way for you to do this is to monitor your Medicare summary notice. That's that document that comes out every 3 months from the Centers for Medicare and Medicaid Services. And this is the document that tells you what claims have been submitted to Medicare, whether they were approved or not, how much they were paid, who the provider was, what services were provided. So what we want you to do is look at those documents, see if you see anything that doesn't look right. Did you actually see that provider on that date? Did you actually see that provider? Did you receive any services? Are there services that are on there that you didn't receive? Or did maybe you get charged twice for something that you received once? And if you do see anything on there that doesn't look right, we need to be aware of that. The explanation of benefits, if you're on a Medicare Advantage plan or a Part D prescription drug plan and you notice something that doesn't look right to you there, the place you're going to find that information is on what's called the explanation of benefits. It serves the same purpose as the Medicare summary notice, just for the Medicare Advantage plan and the Part D drug plan. Another place where you can find this information, I talked a little bit earlier about signing up for that Medicare.gov account. If you sign up for that Medicare.gov account, you'll be able to see this same information on your account. You'll be able to identify that same information and you can report if you do see any charges that don't look right to you. And so it's a really good idea, again, to sign up for that Medicare.gov account so that it gives you another opportunity to identify this information as early as possible. And then if you do see something that doesn't look right, don't keep it to yourself. We need to know about it. And the first thing we want you to do, as I said earlier, most of what occurs are simple errors. They're just where somebody accidentally pushed a button too many times or whatever. The first thing we want you to do is contact the provider. Mistakes happen. If it's an honest mistake, they're going to be happy to fix it. But if after you talk to that provider, it still seems fishy to you, we want you to give us a call. Talk to us about it. Help us go over it with you. We're happy to help you sort things out. We can also, if when you're talking to us, it seems like something that, we need to be passing this on to other law enforcement folks, we'll help you with that process as well. We have a system that we utilize as part of our grant program where we can document all the information and then get it forwarded to the folks in Washington so that they can follow up on it. We've actually had some cases that have resulted in being part of bigger investigations and resulting in actually resolving some of this. We'll use the term resolving. Now, here's our contact information for our program. We are called the Medicare Assistance Program. You can actually call us not just about fraud, but any questions that you have regarding Medicare. As far as how Medicare works, how do you sign up for Medicare, what are your options with Medicare, if you need assistance, if you're low income and you need some help paying for your Medicare, we're there to help folks. We're a division of the Oklahoma Insurance Department. We are funded by federal grants. If we don't have the answer, we'll help you get to someone who can. Our website is on here. That's our 800 phone number. Also, you can send emails to that map at oid.ok.gov website. We want you to report fraud. If you've got a group that you'd like for us to talk to, we're happy to do that as well. And now I think we are to the point. We've got 10 minutes. Let's go with questions.
Thank you so much, Ray. That was very informative. We really appreciate you joining us. And we do have a few questions from the chat. So the first question is, will I hear back from someone at SMP or another agency if I file a suspected fraud complaint?
Okay. The good news is you've helped fight fraud. The bad news is a lot of times, I told you that a lot of times these investigations take place over multiple years. When a report like this comes in and it gets reported to the agency, like when something comes to us, the federal agency that it goes to is the Office of the Inspector General. And what they're going to be looking for is other cases with the same provider or in the same area. They want to gather as much information as they possibly can so that if they do take action on this, they know it's going to stick. So a lot of times when someone as an individual is reporting fraud, you may not hear back as an individual. A lot of times that's what we want. We feel like we've been a victim and we want someone to call us and say, we got the bad guy, the hanging is at noon. But unfortunately, a lot of times it becomes part of a bigger investigation. So typically what will happen is it gets reported and we may not hear about anything ever again. If we do, it may be years later. There's an example of a case here in Oklahoma where a hospice provider was reported, and we made the report, and the only way we found out that this person was actually this entity and this individual was actually prosecuted was one of our employees saw an article about it. And so sometimes we do, sometimes we don't hear about it. The good news is when you do report something like this, not only do we report it to those agencies, but we help you walk through the things that you need to do as an individual to protect yourself and to try to minimize the damage as well as correcting the issues.
That's great. The next question that we got was, if I feel like someone isn't being provided the care they should be receiving in the hospital or nursing home, or even in their own home by a home health agency, is that an SMP issue?
It actually is not. This would actually fall under the banner of quality of care. It is something that our division works with. So you could still call us. It's not necessarily going to be fraud. When we're talking more about quality of care, then it's going to follow a different route. Let's say that you've got a loved one that is in the hospital, or maybe they're getting home health care or some other Medicare covered service. Then there is a process that you can follow to report that. There's an entity that's called KEPRO, K-E-P-R-O. They are the Quality Improvement Organization that covers Oklahoma. They cover multiple states, but they're the one also identified for Oklahoma. And we refer those people to KEPRO to report those type of issues. KEPRO steps in, they do their own review of the medical records of the treatment, they interview involved parties, and they will step in when necessary to represent folks. An example of this would be, let's say that you've got a loved one that's in the hospital, and the hospital is saying it's time to go home. And either the patient or their family, they're feeling like it's too early for this person to actually leave the hospital. They can actually contact KEPRO, and KEPRO will step in to do their own review. And until that review is completed, the individual stays in the hospital. So it's a great way to make sure that people aren't being sent home too quickly for other reasons. Now, let's say that your loved one is in the nursing home. Let's say that they're in a nursing home where they live. That's actually not going to be a KEPRO issue because Medicare does not pay for nursing home care. That's actually, if the state's paying for it, that's going to be Medicaid. But they can still report those to the Oklahoma Health Services, what used to be DHS. So they can contact DHS to get those reported.
These are great resources. Thank you so much for sharing. And our last question is, can I make an anonymous report?
Okay, yes, you can. You can make an anonymous report. If you are a beneficiary and you want to make an anonymous report, you can do that. Just be aware it's much more difficult for the law enforcement people to do much in terms of taking action because they can't drill down to the exact information. But it's still important to report it because it puts them on alert. It makes them aware that something could be going on there. If you're a professional, and we do actually get you probably heard the term whistleblower complaints. We do get reports of those individuals, and that is the same thing. So yes, you can make those anonymous reports. It's better if we can get some detail, because the more detail we get, the more specific law enforcement can get.
Perfect. Well, that is all of the questions that we have today.
All right. Well, great. Folks, I am so glad that you came to join us again. I thank you so much for joining us for our series this year. This has been really good. I appreciate all of our speakers who spent time out of their busy days to come and speak to the folks that joined us. We are going to have some live events coming up. If you will, Rachel, remind me what the dates are.
Absolutely. So we're going to have 2 live events coming up. The first one is going to be on June 23rd, and the second one is going to be on July 14th, and we're going to be getting some more information available for everyone starting May 16th, so be watching for that.
Okay, great. And be aware, it's probably going to be some of the same speakers that we had here, but please get the word out. If you know somebody that might benefit from this and would like to come, it will be held at the Oklahoma Insurance Department. Our address is 400 Northeast 50th Street, and we would love to have people join us. And so, as she said, we'll get more information out about that. If you do suspect any kind of fraud of any kind, please report that. We need to know about this. If we don't report it, they get away with it. So we appreciate you guys joining us. Don't forget the recording of today's webinar, as well as all the webinars that we've had for this series, are available on our website. You can go to www.oid.ok.gov/senior fraud to listen to any of those recordings. Today's recording should be available around 3 o'clock this afternoon. So again, thank you guys so much for joining us, and we hope you have a great week.
Thank you again, Ray.